Hi, this is Josh, Dream Body Clinic, and today we're going to talk about Muse cell dosing. So Muse cells are a pluripotent stem cell. They're found within mesenchymal stem cell cultures, and we're now offering these. We can now isolate them and replicate them to offer in treatments. We found, based on Dr. Dezawa's research and work, that you can use these mainly with an IV as the best administration process, but we also asked her on the dosing. So if you stay tuned in this video at the end, you're gonna see Dr. Dezawa. She's the professor from Japan that discovered Muse cells back in 2010, explaining what they found in different studies. And dosing wise, she believes 15 million Muse cells is the ideal dose for an adult. But she also explains, people in Japan tend to be a bit smaller. She actually uses me as the example. So I'm, about 6'3", 245 pounds. So I'm a bit bigger than she is. She's about 5 foot tall. She said, for me, 20 million is probably best. So we're just going to offer 20 million across the board. Seems like that should be the best dose because they did a study comparing with neonatal patients, your babies, newborn babies. A lot of times a real common issue with newborn babies, if they're prematurely born, is that they give them oxygen, it fries their lungs. And they want to find ways to fix this. So we know a clinic here that was doing this with mesenchymal stem cells worked really well. But in Japan, they did the same thing. They did an IV of Muse cells for these babies that were prematurely born. Their hypoxic ischemia, I think it's called, when their lungs are all fried from it. And it's one of the top causes of death for newborn babies that have been prematurely born. So they gave them 1.5 million Muse cells because they're so tiny. So it was 10 times less of a dose. And then they wanted to see, they're like, well, maybe we can up these numbers and we can get better results, even though they got really good results, if we give them the full 15 million. And when they compared the two, they found same results. So just like MSCs, there seems to be a point of diminishing returns. So think of it like a parabolic curve. It starts to flatten out at the top. With MSCs, we found that tends to be around 1.4 million per pound of body weight. But with Muse cells, it's really seeming like that 15 million is right there. And Dr. Dezawa doesn't recommend we go higher than 20, so we're not going to. We'll do that. Maybe in the future, we'll play with higher doses, but it's got a few advantages. First, the studies back it up. She backs it up and she discovered the thing she should know. And third, it helps keep the cost down, because one of my big concerns, with Muse cells, there's clinics out there all charging a fortune for these things. I don't feel comfortable doing that. We're going to, give a price that we're hoping is affordable enough for as many people as possible. It's always been our goal, give the best price to help as many people as possible. It's probably the most pushback I get from people. They're like, why are you so cheap? And I go, I charge you more if you'd like, but we want this to be accessible. You see some of these other clinics promoting with all these celebrities and you think they're jam-packed, but they're charging, tens or $20,000, $30,000 for a treatment. And, not everybody can afford that. Very few people can afford that. And the problem is they're not getting a better value or better product for it. They're just paying a clinic more money so they can give more celebrities free treatment. So we don't play that game. If you want to learn more about us, check out www.dbcmusecells.com. Stay tuned. Watch Dr. Dezawa explain this in her own words. I'm Josh. Happy to help.
How do you decide? I know, like you say, like 15 million, all the studies are based in that doses, but how do you decide to go with that number and not higher or not lower?
I think the 15 million is already plateau in case of Japanese. But please remember, Japanese are short and smaller than you are. Like Josh. Josh is much, much bigger, right? In those guys, they will need 20. It depends.
It's not based on the weight, height, or something, or it's not based on the condition?
We did in the same constant number in Japan. But I think, the some, like in a kid, you can reduce. But this is very impressive. This is very impressive. Okay, we can learn from the HIE. So the reason why I did this is that the doctor, in the first case, they were scared to treat a neonatal. It's a very tiny baby. So they treated 10 times less than adult. And then doctor expected much more effect if they treat with a 10 times more. So this is 15 million, this is 1.5 million. Outcome was the same.
Yeah.
So this tells us that if the effect reach a plateau, even if you treat the patient with 10 times more, 20 times more, it's the same.
Yeah.
Waste of the cell. Waste of the cell.
There is not any risk to have a problem or something doing like high doses on the IV, for example?
I don't know. Well, I don't have any report or data. The comparing in human 10 times more versus the single dose with 60 million, how the adverse effect will be or something like that. I don't know.
Okay.
But I think the high dose will be burden to the lung, and in the standard Japanese adult size 50 million was a plateau. So even if you 10 times more in the treatment, yeah, it's the same. It's a waste of cells.